So, sir, you are working on many things.
Yes.
Like you can't even see with your naked eye.
Yes.
So, how do you feel about that, sir? So, you can't even see, but you have to work with that.
Yeah, that is one of the important thing, because when we started our career, it was a big revelation for us. Okay, we can't see many things in our naked eye, even for sperms and oocytes. So when we saw this initially in our with the microscope, with the help of microscope, it was a big thing for us. So that is very important thing. Yeah.
So far you have made so many embryos and so you have fertilized so many things. Like, did you feel any case like complicated? Some eggs you might they have developed very well since the third day, but something might happen after the fourth day.
Yeah.
But you need to implant those on the fifth day into the patient. Like, how do you tackle those situations, sir?
Yeah, the question is correct, because we will be assessing the embryo quality based on some intervals, time intervals. So first, if we are doing that means ICSI, that process, we will be assessing the embryo quality on day 1. So that day we will be assessing the quality. If it is good, okay, everything is fine. We will be separating those, and day 3 we will be assessing the quality. So on day 3 we will get an idea, okay, how many is grade 1, grade 2, grade 3. So we will separate those grade 1 and we will let it go for day 5. So depends, if for example some patient, they will be getting 15 oocytes, 15 eggs. So out of 15 eggs, everything will not be great. So what we will be doing is, actually out of this 15, if you are injecting, means for example 13 the embryos will form. Out of this 13, for example 8 is good on day 3, means out of this 8 only 5 or 6 might be coming on day 5. So we can select whichever great embryos on this particular day 5 embryos. So and then we will be transferring that back into the mother's womb.
So the best one you will be
transferring. Yeah.
So sir, you said the grading part.
Yeah.
So how do you grade, sir, in the embryos you got? So how do you grade them?
Morphologically.
Okay.
So we have some strict protocol, actually they are implementing that. So we will be assessing this embryo quality based on morphological. So if a morphology is very good, we will be needing some 3 things, actually: what will be the size of the oocyte or embryos, how good it looks. So there will be some other problems like fragmentation, then like around some other issues will be there. So we will be selecting whichever is grade 1. So we have a criteria. So grade 1, grade 2, grade 3. We have a strict protocol with that. Out of that, whichever is good, we will be selecting that. Basically, morphologically only.
So how do you maintain the standards in the laboratory, sir? So you need every equipment to be
Yes.
running so very fastly and on time.
Yes.
So how do you maintain everything?
Yeah, sure. Because Ferty9 is, luckily we got a very good lab, actually. So standard class 1000 lab. So it's like, according to the terms, that will be the best lab IVF setup should get, actually. So that is a very setup. So our management have provided us one of the best lab in India. So we have separate instruments. Even for instruments also we have that means how to measure those things, whether it's working. That control system is also we have. Other than that, we have a strict QA QC, that means quality assessment and quality control. So we'll be assessing daily. So what will be the control time? So what will be the measurement? What is maintaining inside the incubator? So with those techniques, we can easily that means monitor the proper functioning of the instruments.